And welcome back. The 24th International AIDS Conference got underway in Montreal, Canada today. The conference aims to promote the latest HIV science. It will also explore a range of topics from surveillance ethics and health innovation to HIV cure and vaccine research. Other discussion topics will include the insufficient global response to the worldwide monkeypox outbreak. Delegates will also highlight the fact that HIV/AIDS is still a significant global public health crisis, which is responsible for 650,000 deaths every year globally. According to UNAIDS, there were over 38 million people living with HIV in 2021. And to talk about this, human rights activist Steve Letsike is the chair of the South African National AIDS Council Civil Society Forum. She joins us now from Ontario in Canada. Good to talk to you, Steve. Thanks so much for speaking to us. So let's just first start with the highlights of the discussion today as the conference kicked off, particularly for Africa. There must have been a great deal of interest, given the fact that the resources that would have otherwise gone to dealing with such endemic issues, such as HIV/AIDS, had to be diverted to deal with COVID-19.
No, indeed, Tsepi, thank you so much for having me, and good evening to the viewers. Indeed, I mean, this is one of the biggest concerns that we have. But one thing that surely we are aware of, pandemics are colliding. We have more than one public health threat. We were dealing with COVID-19 that joined many other public health threats that we have in South Africa and across the globe. We have an issue of HIV. We have an issue of TB. Across the world, South Africa still ranks number 6. And here we are, we had a public health threat such as COVID. And all these different pandemics are colliding, which then makes it difficult, because you are seeing finances shifting, the paradigm shift of priorities, and how integration is also coming up and saying, what have we learned and what is it that we need to be doing? But I think what is quite key, really, with all of these things, HIV still remains the top of the agenda, because all the others, we know how to deal with them, whether the innovative aspect of response from vaccine, from treatment, and so forth, we are able to deal with it. HIV, we still do not have a cure, so we rely on society to be then preventing, taking treatment, so that we can suppress the viral load.
You know, Steve, we're having a discussion with someone just with regards to the monkeypox outbreak, and I'd just like to hear your point of view on whether the inane biases that occurred when HIV/AIDS came to the fore, for instance, if attitudes have changed, because we know when monkeypox was revealed to the world, what the color and shape of it, and I mean it literally and figuratively, that it was assigned to certain races. And now we're talking about the WHO releasing guidelines to underline health responses to HIV, viral hepatitis, sexually transmitted infections, and 5 key populations. But I'm just wondering, is there acknowledgement of the lack of change in some of these responses that could actually set us back?
Indeed, I mean, this could set us back, because whether or not we are talking about any kind of pandemics, including now what has been an outbreak of monkeypox, we have to understand the outbreak, is whether our governments or public health response can relatively contain any kind of outbreak. That's number one. 2, is any outbreak happening require hospitalization, require such a robust response that will require all different stakeholders, government, civil society, private sector, chipping in, but also public, and in terms of containing the outbreak itself. But at the same time, what it really means, any kind of outbreak, if we are not dealing with it, and if we don't send the correct message to the public, we run a risk of actually exacerbating stigma, exacerbating attitude, behavior around specific things. And I think we've seen this a little bit in South Africa when we had a Department of Health that led a press conference more than a month ago, which actually sent a wrong message to the public around a specific population, and that is not supposed to be. There is indeed some of the cases that were identified in South Africa, but in terms of the transmission, the mode of transmission, and how we clarify information to the public so that the people know how to prevent, how to contribute to the response by virtue of preventative measures as opposed to responsive interventions.
So for Africa in particular, what are the contextual factors in terms of service delivery? And we're talking beyond strengthening of our health systems now, because even though we needed that sharp wake-up call, but going forward, and it's no longer just about allocating funds, it's a holistic approach.
Seppi, I think one thing that we need to accept, over time, we have learned to understand how we deal with an epidemic. HIV still remains the biggest epidemic in South Africa. TB remains the biggest, number one killer in the world, and also here in South Africa is tuberculosis. Now, what we got to understand, there are biological, behavioral, social and structural drivers of any kind of the epidemic that is really we are dealing with. So what we got to understand is what tailored interventions are required. First, from a clinical or biomedical point of view, what needs to happen? Secondly, what needs to happen outside the clinical setting? That's one of the reasons when we said dealing with HIV, it's not only a health competency. It requires every department, it requires every stakeholder playing in a role. And that's why our response in South Africa has always been centered from a multi-sectoral point of view. One of the things that we have even prioritized in the development of the new strategy is a people-centered response to them. We are spending so much, and in our spending, we are actually seeing a lot of investment that is going to clinical, non-clinical interventions, but investing in behavior will also help us request South Africans and people in South Africa to change the way they actually also contribute to the prevention and treatment agenda. And I think it's quite important. The hospitals, we know they are overburdened. If we actually invest in prevention effort, we are more likely to see the reduction of hospitalization or a need of hospitalization. But it also speaks about dealing with other diseases, whether you're talking about other chronic diseases or non-communicable diseases. We need to understand what healthy lifestyle will look like. How do we reduce the burden on the health system? But also, how do we take care of ourselves in a way that helps us deal with prevention? A lot of our across board is responding as opposed to prevention approach.
Before we run out of time, the issue of surveillance ethics came to the fore when we're dealing with COVID-19. As you mentioned, we will going forward deal with multitudinous pandemics. What is the latest in terms of policy directives coming out of the conference, or that is going to be dealt with?
Look, I think one of the key things is that innovation has been displayed by scientists. And I think we have been fortunate as South Africa to have amazing researchers that are recognized globally. There has been innovations around PrEP, that you have injectable PrEP, which then means people don't necessarily only have to take oral PrEP, which the biggest issue is around access and equality for that matter. Secondly, there has been a proven scientific innovation as well around the ring, developing ring, that has always been proven to also help us prevent new infections. So the theme of this conference says, follow the science. We know exactly what needs to happen because innovation has proven that we can prevent. And if we also can take treatment as prevention, that we move with many 8 million South African living with HIV, who need to be initiated, because so far we are just over 5.1 million people who are on treatment, but we need at least another 2 million people who are living with HIV to be urgently initiated. And when they adhere, we can suppress the viral load. So we cannot accept that we are off the mark as a country. We are off the mark as a global community. We need to make sure that our public health response speak to us investing in order to save later. We are worried financing is reducing. We are worried also that innovation can be tested and must be costed appropriately. The pricing must be negotiated globally, but also we need to invest in effort that can be proven. And that's what the message coming from this conference is.
I'm sure we will speak to you as the conference continues. Thank you very much, human rights activist Steve Letsike, who is at the conference on behalf of the South African